Hello, and welcome to Transgender 101 Identities, Terms, and Pronouns. My name is Ray Holloman, and I will be going through this presentation with you just to give you a little bit more insight about working with transgender people that you may interact with in your workspace or in your life. So, to begin, a little bit about me. My pronouns are he, him, his. I am a queer transgender man, and I'm chair of the Tennessee Transgender Task Force. I'm a member of the Vanderbilt LGBTQ Advisory Board, and I do a lot of transgender education and I'm advocate. I'm also currently in school as a doctoral student in change leadership for equity and inclusion, really focusing on community leadership and change. And so this is really important to me to be able to educate communities about transgender people to make sure that all transgender people can have affirming interactions with various people. Through this presentation today, we're going to go over really three main topics, really looking at sexual orientation, how that differs from gender identity, and then providing care. Because I think that these three things all really come together to really think about how can we best affirm our transgender people that we interact with in different aspects of our lives. So we're going to start off today with just sexual orientation. Currently, there are over 20 million self-identified LGBTQ plus Americans, and that number continues to rise, and that is people who are self-identifying as LGBT. There are people who choose, for whatever reason, to not identify with one of those labels, but they would still maybe fall underneath that umbrella. And so really thinking about how can we ensure that we have thinking about how can we make these spaces more inclusive for everyone. And so when we start thinking about the dimensions of sexual orientation, there's really three ways to really think about it. There's that person's identity, and that goes back to the previous slide of like, how do you describe your sexuality? What is the thing that you say? If somebody comes up to you and you're chatting, you're getting to know each other, and the topic comes up around sexual orientation. How do you identify? Do you say that you're a lesbian? Do you say that you're a man that has sex with men? Do you say that you are bisexual, queer, pansexual, heterosexual? How are you identifying your sexuality? And your identity doesn't always have to match the behavior that you do. And so behavior really is more around who do you have sex with? So who are the people that you are having sex with? What's that behavior look like? Your identity could be that you could say that you are a gay man, but you may also have a behavior to have sex with people who identify as women, and so those don't always have to line up, which then also brings to the third thing of like, who are you attracted to and who do you desire? So all of these can vary. And so if we think about sexual orientation being on a spectrum, your identity could be one thing, but your attraction may be something else, which can be confusing to some people because we think of so much of the space of being a binary. We think of it being you're either gay or you're straight. You have sex with, if you're a man, you have sex with women or you have sex with men. We think about it being this very much a binary when it actually more can vary and it can change throughout your entire life. And so when you're thinking about those types of things, these dimensions come into play. So just because somebody says their identity is one thing, their behavior and attraction may be something different. So thinking about those couple of things really gets you to start thinking about what does that sexual orientation look like. And so when we're talking about sexual orientation, we're really talking about the emotional, romantic, or sexual feelings towards other people. And so if we start at the top, that's if you are a man, if you are a heterosexual, you're going to be attracted to people of the opposite gender. So if we're on the binary, from a man, that will be to a woman. Now, taking that same scenario, If you're a man and you're attracted to someone of the same gender, you could be either gay, lesbian, some people may even still say homosexual. Those are all saying that you are attracted to the same gender that you are versus you have bisexual, which may be attracted to both males and females or to more than one sex or gender. And that really comes into play more when you start thinking about gender identity, which we'll be talking about next. But you could be attracted to men, and technically trans men could fall into that category for you, but you may not be attracted to females or female identified people. And so depends upon what's your attraction level, what is the thing that you have the feelings towards. Now, we'll talk about queer. That there are some people who still, claim that, they won't use this word, but a lot of younger people, especially millennials such as myself, have reclaimed that word because it's kind of more of an umbrella term to be, of a sexual and gender minority, because I would say that I'm not heterosexual and I'm not cisgender. And so for me, that word makes a sense because if I'm going to have to label, I want to be able to have like the broadest way. But some people may also say that they're pansexual, and that may be that they are uh, emotionally romantic and physically attracted to people of all genders or biological sexes, or more than just one or two that they may be interested in. And then there are asexual people who may not be sexually attracted to other people, but each asexual person is different. They experience their relationships, arousal, attraction, all very differently. And so this is where you can't really say that if you've met one asexual person, you've met them all. You really have to see like what about that person. They may not want to have sexual feelings towards somebody, but they may have emotional or romantic feelings for some towards somebody else. And so this is just a high level of like the broad categories because you can get more in depth into each one of these categories and like really whittle it down. But really just saying at a high level, this is what sexual orientation looks like because sexual orientation is different from gender identity, even though it all falls under the LGBTQ umbrella. When we're thinking about the L, the G, and the B, we're really thinking about sexual orientation. When we're thinking about T, we're talking about transgender people, and we're thinking about gender identity. And I think that gender identity, which is the section we're moving into now, is a really important thing to think about because it's really on a spectrum for a lot of people. Uh, you know, and even though we hear so much about it in the news currently, it really is only 1 to 2% of the population identify under the transgender umbrella. So if you're thinking about that, if we're thinking about everything that we see in the media, everything that is going on, we're talking about 1 to 2% of the population that identifies this way. And there are people who may fall under the umbrella that may not necessarily think that they're part of the umbrella, which we'll talk about a little bit more later. But if, as we start thinking about the two categories of gender identity, you have a cisgendered person, and that is someone whose gender is aligned with their sex assigned at birth. And they're primarily going to use female, if they're female, they're going to use female pronouns that we know as she, her, hers in English, or male pronouns, which are he, him, his in English. However, there are transgender people whose, and that's really an umbrella term, whose gender identity differs in various degrees, really thinking back more to like the spectrum from their sex assigned at birth. And so for females, pronouns are going to be the same. For males, they're going to be the same if they choose to use those pronouns. And then there's non-binary people, and those are people that don't feel that they are strictly female, they're strictly male. They're more of this, they want to be somewhere, they are more in between. They don't feel incredibly feminine, they don't feel incredibly male, more of that androgynous type person. And so they're going to use they, them, theirs pronouns. And so using it in the singular they, but there are also so many other gender expansive identities that also fall underneath this umbrella. And basically, it just means that this person does not identify with the sex they were assigned at birth, and all the roles that come with that. And so, if you're thinking about gender expensive people, maybe gender queer, people that are gender fluid, agender, things like that. But that's really looking at what is their gender identity. So, when we're talking about gender expression, that doesn't always align back to gender identity. And so when we think about the gender expression, a man's got probably a very masculine presentation. Female's going to have a woman gender identity is going to have a much more feminine expression. And that's what we've kind of historically always thought. That's how it would be. But this is a much more inclusive model. So you could have somebody who, I'll take myself for an example. My sex assigned at birth was female. My gender identity is a man. And my gender expression is masculine. And my sexual orientation down at the bottom would be more in that middle category. So if you think about it that way, that's much more, I'm very much, very masculine presenting in my identity and my expression. I always like to tell people that when I transitioned, the thing that changed about me the most was my name and pronouns. Because before I transitioned, when I was younger, my gender expression was always very masculine. From as far back as I can remember, I had a very masculine gender expression. So the things that shifted for me was my gender identity shifted to a man, but my gender expression had always been on the more masculine side. Likewise, you could have a somebody that is assigned male at birth. Their gender identity may be uh, a man, but they may have a feminine gender expression or an androgynous gender expression. It can go all of these various ways, and it can change. If you have a gender fluid person, it may change on a it may change depending upon what day it is or how they're feeling. And I also want to take a second to think about intersex people who a lot of times may have been born with ambiguous genitalia, and they may have to determine, so their identity and expression may all vary changed based upon, what they if any surgeries happened when they were young until when they are an adult and they figure out. So all of this is varied. And so if we're thinking about this model, you have males, you have females, so don't gender identity does not equal gender expression. Those are on their own, separate spectrums. And people can shift depending upon where they are in their life, what they're doing, things like that. And so I want to take a moment to talk about non binary identities. Non binary people are people who don't feel like they're fully female or don't feel like they're fully male, but each and every non binary person experiences gender differently. And I would say almost everybody experiences their gender very differently. And so, but non binary people, I want to take special care to talk about because a lot of times they don't use what we would call the, traditional pronouns or he, him, or she, her. They're using they, them, or some other type of pronoun, neo pronouns, which we'll chat about. But you don't have to understand their identity to respect their identity. So asking them what their name and the pronouns that they want to go by is just respecting their identity. And so you're really asking them how do they want to be treated and then treating them in that way. And so it's no different than, asking somebody like how can you, help them what their preferences are, what do they like, especially like if they have a dietary requirement, like we would be affirming of that. So why are we not affirming of their identity and making sure they are getting what they need from somebody? So everybody can experience their gender very differently. And so to kind of take it back, we're looking at your sex that was assigned at birth. That's what's on your birth certificate versus your gender identity versus your gender expression. So your sex assigned at birth is really based upon the absence or the presence of a penis when you are born, or the absence and presence of a vagina when you are born. Intersex people, which we talked about a couple slides back, are people who biologically do not fit into those clear cut boxes of what's expected to be a male or female. And if you look at that percentage, that's 1.7% of the population is born with some variation of intersex traits. That is comparable to trans head, to redheads. That is comparable to also trans people in general. We were talking about that 1 to 2% of the U.S. of the population is considered uh, themselves to be transgender. That's that same. But I am not saying that intersex people are transgender. There may be intersex people who, based upon in their mind, may feel like they fall under, especially if they fall into that non-binary category. They may consider themselves a trans person, but intersex people are not trans people. But a lot of times they have to go through very similar surgeries like a transgender person would because of decisions that were made before they were able to give consent. And so that is something that we have to think about as well. So when we think about gender affirming surgeries, that doesn't always just mean that the person is transgender. It may mean that something has happened to affirm their gender. It could be a whole host of medical things that could have happened that means that they need gender affirming surgery. So it's not always just trans people that are the only people that are getting gender affirming surgery. Now, gender identity, that is that internal, how you think of yourself, that's not visible to other people. That's either being male, female, neither of them, or both all at the same time. That's not visible to other people's. Only internally what you feel to be. Versus gender expression, that's that external. That's how you're going to dress, what it means to be male, female, neither or both, how you go out in public, how do you perceive yourself, how do other people perceive you based upon society. Your gender expression, that is what we see as being visible to others. I really like using this infographic because I think it really starts putting it that we take it out of being this very binary thing between being a man or a woman or some other gender. If we start from the top, it's like, what do you feel like you are inside? So that can be that you feel very masculine. You could be feeling like you're a male, but your gender expression could vary and feel very feminine, or it could be something completely different. The only thing that's really more it's options is that really that your sex assigned at birth. That's going to either be female, that's going to be male, or it's going to be something else. It's going to be intersex based upon how you were born, how things work. But that is something that doesn't have as many options. But if you look, that's only one part of the whole entire picture. Because if we look at the bottom half, who you're physically attracted to and emotionally attracted to, back to sexual orientation, that's all very different. So, we're thinking about the gender identity and your gender expression. That is all, you know, your gender identity is how you see yourself. Your gender expression is how you want people to see you based upon society's norms. All of these different things really help to make who you are as a person when we're thinking about your gender identity and your sexual orientation, and how that may vary. A person could take this now and they may take it again in 10 years, and they may see that for some people, it never changes. But for other people, there may be shifts in some of these things of who they're physically attracted to, who they're emotionally attracted to. What does their gender expression look like? For some people, it may change, daily. For other people, it doesn't. And so I think just getting that this is something that can change really gets you into that mindset of that it's more of a spectrum versus a hard binary of male, female, in this kind of mindset. So then there are also gender pronouns when we think about these are not the only pronouns. Like we English speakers know she, her, he, him, they, them has come into a lot of presence, but there are a lot of people that use Z for their pronouns. I know people that also use it as their pronouns. There are people who don't want pronouns to be used for themselves at all, or people that'll go by any pronouns. And so asking someone for their pronouns is very important in the part of like respecting them as a person. That's something that we really have to take care into is making sure that we aren't making assumptions. And then when we know their pronouns, we are using the pronouns that they have asked for. And so this way it really allows for us to see those types of things and basically have some examples and some of the more what we would call a neo pronoun. So it's not the she, her, he, him, they, them. It's like the Z and the zers and all of those. Those may take time and you may need a person to kind of explain how would you use those in a sentence. There's some examples here, but understanding that it is all about respecting the person and making sure that we are giving them the respect that they deserve, just like we would want them to respect us. And so learning their pronouns as well as their names is just a very important part of that. And then wrapping up into this last section of providing affirming care, we think about these systems of inequity. And so for transgender people, there are certain barriers that are already in place that, impact transgender people. Uh, for people who are listening to this and they live in the state of Tennessee, transgender people cannot update their birth certificate. That is one of the few documents that you can use to prove your citizenship. So you may be a trans person trying to get a job and you may be stealth and you may not want your new company to know that you're a trans person. But if you only have your birth certificate to prove that you're a citizen and it has a gender that is not what you are currently presenting as, you are immediately going to get outed. And we would hope that places would respect your privacy, but we know that doesn't always happen. It's not. And so the only way to get around that is to get a passport. But passports cost $200 by the time it's said and done versus uh, a birth certificate change costs $15. So that already is creating a system of inequity because that may give them a barrier to education. If they don't have an education, that may put them at a risk of not being able to find a job because they don't have the ID that shows them who they truly are. If they don't have a job, then we can see how that impacts healthcare because here in the US, so much of our healthcare is tied to our employment. And so that means that they may not get the medical help that they need, but also not having a job means that they may be homeless and they may be homeless because they weren't able to get an education because they weren't able to have an ID that matches their name and gender. So you can start seeing how these all start impacting each other. And this is based upon just thinking about not having documentation that really shows who you are as a person and things not always being aligned together. So, if you're thinking about what can you do, in your practice, in your day to day, it's first of all understanding to recognize one's own bias. You may have, we all have implicit internal bias that we don't even think about. And so just recognizing that that is a thing and then learning, growing, making sure that you're trying to educate yourselves. Refraining from making assumptions about people based upon, who they are, what do they look like, and really starting to ask questions using that inclusive language that makes people feel like they belong there and that they're wanted there versus being considered as like, oh, we don't want this type of person in our presence. Also, just thinking about considering pronouns asking, if you're going into an interaction with a new person, knowing the right pronoun and asking that for everyone. So then you're not excluding out, and particularly making consideration for trans people because, there may be somebody with a gender expression that varies from what we would see as the norm, but they may use pronouns that are more typical with the sex that they were assigned at birth. So just starting to ask, hey, consider pronouns, asking people what their name is, what do they want to go by, uh, because we do that so much anyway. If we think about how many people go by a name that's not their legal name. So if we just start making a consideration, hey, my name is Ray, my pronouns are he, him. What's your name and what pronouns do you use? We ask that of everybody. We make it more inclusive for everybody. Making forms inclusive to ask for these types of questions, especially if you're in the medical setting, making sure that you have the correct information and understanding that there are different ways that you may have to think about somebody's gender or sex. So their legal sex may differ from their sex assigned at birth, which may also differ from their gender identity. But in the medical setting, those can all be very different. Like, technically, my legal sex is male. Uh, my gender identity is a transgender man. Uh, but I was assigned female at birth, and so for a person to treat me, they may need to know what my gender identity is, and they may need to know what my uh, legal sex is for insurance purposes. So knowing all of that information, and so understanding and taking an inventory of what organs a person has also helps because that may help you narrow down. I, have not had a hysterectomy or anything like that. So whenever I go in for surgery, I still have to do a pregnancy test because there's still that possibility that I could be pregnant. Knowing those types of things, so making forms inclusive so people can give you the accurate information, but in a way that is also affirming, and maybe they don't want to have a conversation about it. And so that helps to foster that transgender affirming environment. So asking how they want to be identified, what their healthcare needs are, and asking those questions necessary for care. I'm a great person to come and ask questions of if you've got general questions about what it means to be trans, what questions, what curiosities, Google's also a great thing for that, but somebody that may be in a vulnerable situation may not want to explain to you what it means to be trans, what it means for them. They are just trying to get the care they need. So, only asking the questions that are necessary and directly relevant to their care. Do you need to know about what surgery somebody's had if they're coming in for what gender affirming surgeries they've had? If they're coming in for a broken arm or a broken leg, not so much. Um, but if they're coming for something gender affirming, obviously that would be more important. And also, if you make a mistake, quickly apologize, say, I'm sorry, you know, I understand, restate the pronouns, and then move on. And then just continuing to educate yourself about transgender patients. Because, like I said earlier, if you meet one trans person, you meet one non binary person, you met that person. We all are so very different. And you should be getting to know each and every one of your patients individually versus trying to, lump them all because we all have so many very differences. And so, my experience as a trans person and my medical transition is going to be different from the person next to me and the next person and the next person. And so, just other tips for supporting trans people in your life, whether these be patients or other people, it's leading with that open mind. It's hard to come out to people, and it's definitely even harder to come out to people in the medical setting because it can be scary. It can be, intimidating to interact with the system, with the healthcare system. So, v- asking questions with care is really important and listen with intention to allow people to really open up and share their feelings. And if you can't be overtly at the pride parades and everything up front, a subtle show of support, a sticker on an ID badge, a pin on your lanyard, just something to be like, hey, I support you, I'm here. That just helps. Also, learning the language that people use is sometimes really important to understand what we say when we mean what's the difference between a trans masculine person and a trans man or a trans woman and a trans feminine person because those may have different nuances, and they do have different nuances depending upon how they use them, so understanding and learning the terms. Also, it's a journey. This language is ever evolving. Trans people are constantly evolving, and there are people who use more labels or less labels, but understanding that, this is going to take time. You're going to make mistakes, but it is a journey. But, there are people like me that are here to help and be this resource to help ensure that, if you do stumble, that, you can get back up, because we want you to not get discouraged from interacting with trans people and making sure that we have the most affirming places possible. And so, if you've got questions, you can reach out to me, contact information. Also, want to just quickly put up there are some other resources that exist. The Program for LGBTQ Health at Vanderbilt, also known as Vivid Health, they do a lot of education and training in this space and across the entire, LGBTQ, identity space. And so they're a great resource. PFLAG is also a great resource for information, especially for parents and family members that may want to learn more and may need additional support. Tennessee Equality Project, they do a lot of good work, especially when it comes around to the laws that try to get passed at the Capitol in this space. And then the Tennessee Transgender Task Force, which is what I am the chair of and have been the chair of, we really try to provide resources and training to people, whether they be trans identified or, they're affirming providers, to just make sure that you can have access to people that can help you through any of those questions that you may have. So you're not having to have a trans person educate you on how to be affirming. The person sitting in front of you, you can come to somebody like me or any of the people that are on the task force, and so that we can have those conversations for you or with your team, so that way you can be better equipped. And so with that, thank you so much. Want to reach out to me. My email and my Instagram and the task force's Instagram is on the screen. I appreciate you listening to this. But please feel free to reach out if you have questions moving forward. And I thank you all so much for listening.